Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Good evening to you, our beloved viewers. Beloved because you wait for us every Thursday. And we also always do our part to look out for the very quality information about your health, because your health is your wealth. So it is our responsibility at the DOCtalk show to take care of that by furnishing you with the latest information about different aspects of your health. And tonight, always, as your host here, Dr. Joseph Gavin Nyanzi, and this show is brought to you by the National Medical Stores, as well as Camelin's Men's Collection. Please, you're reminded of our social media platforms on Facebook, as well as YouTube, the DOCtalk show. I know you could be having a comment or a question. Leave your comment or question in the comment section below and share the link with your family and friends. In studio with me this evening is none other than Dr. Richard Idro. Dr. Richard Idro is a pediatric neurologist and is a senior lecturer with Makerere University. Dr. Idro, you're very welcome.
Thank you very much. It's a pleasure to be here on DOCtalk.
And of course, the other thing I forgot to talk about, Dr. Idro is also the immediate past president of Uganda Medical Association. Tonight, he's not going to talk about the Medical Association, but he's going to be discussing something very crucial and is with us. And there is a lot of misinformation about it, and he's going to shed more light on it because this is his area of specialty as a neurologist. Neurologists are specialists who deal with the brain and the nerves. So the topic of discussion tonight is epilepsy. Maybe you've heard about it, and maybe you've heard different things about it. So we have a specialist in studio tonight, and is going to break it down for us. Yes, Dr. Idro, epilepsy. I gather that every second Monday of February is the World Epilepsy Day.
International Epilepsy
Day.
Yes.
Yes, please, Dr. Idro, tell our viewers about this epilepsy. What is epilepsy? Yeah.
Thank you, Dr. Nyanzi. Every second Monday of February, for the past several years, we celebrate the International Day of Epilepsy. This is a day that promotes awareness and a day when we join hands with the families, with patients with epilepsy and their carers so that we can give them the appropriate support in this condition they live with. So what is epilepsy? Epilepsy is one of the leading chronic brain disorders. Chronic because it's something which is long-term. But it is a brain disorder in which you have an abnormality in the way the brain cells communicate with each other. We have billions of cells which make up our brain. And the way they communicate with each other is through an electrical circuit, the flow of, similar to the flow of electricity in the cables which we have. Occasionally, and this flow of electricity or flow of electrical current is so organized. There are some cells which may increase it, other cells which reduce it, so that you have a uniform and organized flow. Unfortunately, there are cells in the brain which have a tendency of producing excessive discharges.
Excessive, like high voltage?
Yes, high voltage. And it's like a short circuit where you have sudden, that kind of activity happening in the brain. And if it remains localized, it may not cause a lot of problems. But if it spreads and involves the neighboring cells,
Okay.
you may then see an effect. So if it occurs in the part of the brain which controls the movement of this arm, every part of our body is controlled by the brain. All activities in our body are controlled by a specific part of the brain.
Yes.
Including behavior, the way we laugh, the way we smile with people, the way we do things, the way I use this arm when I'm walking. So if it affects the way I use this hand, my hand may jerk.
Oh, yeah.
If it originates all over the brain, the whole body may be involved. Now, that is a single attack. We say it's a seizure or it's a fit.
Okay.
Or sometimes people say it's a convulsion.
Okay. So
But
you talked
if you-
about 3 terms there.
Yes,
Fit, convulsion, seizure.
yes.
I know you usually use those terms and people may think they're different, but it's the same thing.
There's a small difference. I'll come to
Okay.
it. If you have a single episode, this is a single attack. But if you get recurrent attacks and which arise out of the blue without any provocation,
Okay.
we are seated here with you, we are talking, and suddenly my hand starts jerking. It happens again tomorrow, it happens again a month later.
Yeah.
If you have 2 such episodes, we say you have epilepsy.
2 episodes. Okay.
Unprovoked, occurring out of the blue,
Okay.
we say you have epilepsy. So that is our working definition of epilepsy. These abnormal attacks which arise out of abnormal brain discharges manifesting in part of the body and occurring in over 2 or more times.
Okay.
Now, this may affect just a part of the body, like I talked about my arm,
Yes.
where my arm may be jerking. We say it is focal because it arises from one part of the brain and only affects that. Or it may arise from all over the brain and like the big ones which we know,
Okay.
where somebody falls
Legs,
down.
both
Yes.
arms are jerking.
Yes, we say that is a generalized epilepsy. But there are other types, the epilepsy manifests differently.
Okay.
So these types which I've described are the convulsions, where you see movements of the body. But in some occasions, you do not see movements. So you just see a child and suddenly the child stops for 20 seconds, for a minute.
Like it's lost.
Yes, it's like lost. It's just staring ahead. You may call Arthur.
And is not responding.
It's not responding. In class, this child may be, and usually it's children in a late top class, P1, P2, P3 there. So the teacher is teaching 1 + 1, and then the child is getting an attack. Then 2 + 2 is equal to 4. Now, whatever is between there, the child has lost it. So what he had was 1 + 1 is equal to 4. So whatever was in between, the child has lost. That type of seizure, we call it absence.
Absence seizure.
So it is a seizure. It is again due to an abnormal discharge in the brain, but
there is no
it is
physical
not
manifestation. Yeah.
there is no fit, there is no convulsion. That is the difference between those 3 terms.
Wow.
Yes.
Wow. This is quite informative. I hope you're following the conversation. So basically, those are the main signs and symptoms of epilepsy?
Yes, there are many other signs. So in other people,
Yes.
it may involve a behavior.
Okay.
So a person is seated here and then suddenly see this person doing things which are very unusual. Some, it may affect our emotions. Others start crying. Others just laughing out of blue, just laughing, and you don't see
The reason
what
for
the
laughing.
reason for this laughter. Others feel extremely sad. Or there are some people who start walking, they'll get lost, they go wandering, they have no idea that they are walking. Somebody will walk from Chirekago and end up in Boegerere and then wakes up, was having an attack.
Okay.
So it may affect behavior, it may affect our social relations, it may affect our emotions, or it can affect physical activity, all different things, parts of the body. And this all is epilepsy. Now, in any community, 1% of the population have epilepsy.
That is in Uganda.
Anywhere around the world.
1%.
So, yes, epilepsy affects everybody.
Wow.
It does not know class. It does not know level of whether you have money or not. So long as you have a brain.
Okay.
Anybody who has a brain is a candidate. So all of us.
Including our cameraman.
Yes. Whether I'm a doctor, whether I'm a journalist, whether I am a peasant, whether I'm a school child. So long as I have a brain, because it is an abnormal discharge in the brain.
Dr. Idro, you're going to pause a little bit there. We're going to pick up from there in the next segment of this show. Wow, I hope you guys shared the link with your friends, invite them. This is very important and quality information for us in this new year. My cameraman, Robert, I hope you've heard. Everybody with a brain, including you are at risk of epilepsy. We're going to take a break. We'll be back in a moment.
You are watching the DOCtalk show.
It's time to learn. Schools are open. As a student, school life is going to be different. You must follow the COVID-19 prevention measures, which include always maintaining a 2-meter distance from others in class, dormitories, entertainment halls, school vans and playgrounds, regularly washing your hands with soap and water, wearing a washed and clean mask that covers your mouth and nose every day, and encouraging your classmates to do the same. Your teachers will also guide you on how to follow SOPs. Don't engage in violence with other students. Report any cases of abuse by teachers or other children to a senior teacher. Those who don't follow the rules should be immediately reported to a class teacher for correction and further guidance. If you experience flu-like symptoms such as a sore throat, fever, dry cough or body weakness, immediately seek medical attention from the school nurse and inform your class teacher. Whenever you sneeze or cough, please remember to cover your nose and mouth with a bent elbow, tissue or handkerchief. Let's share knowledge, not COVID-19. This message is supported by the Ministry of Health, Ministry of Education and Sports, and UNICEF. Stay safe.
You are watching the DOCtalk show.
Thank you so much for keeping it here with us. Still, we are streaming live on our social media platforms, Facebook and YouTube, the DOCtalk show. If you have any questions, please leave them in the comment section below, and I will be getting back to you. Please share this link with your friends and family. Let them not miss out on this very important information this evening. Special mention of our sponsors of the show, National Medical Stores and Camelin's Men's Collection. For those that are doing interviews or you have a wedding this year or any party, this is the place to go and get yourself a very, very, very beautiful jackets, very beautiful suits. They are located at Zebra Plaza on top of Entebbe Road, intersection between Entebbe Road and Kampala Road. And you'll not forget this year. Dr. Idro, before we broke off, you said everybody with a brain is at risk of epilepsy. 1% of in any community, 1% of the population has epilepsy.
Yes.
Please pick it up from there.
So, in other words, if you have 100 people anywhere, you may almost be sure that one of them has epilepsy.
That means for Uganda, that will be around 45 million.
In Uganda, with a population of 45 million, that means that we have a minimum 450,000 people with epilepsy. But having said that, there are parts of this country where this prevalence is much higher. In the north of the country, in some of the mountainous areas towards Renzori area, parts of Bunyoro, in some of these regions, up to 2% of the population may have epilepsy, which may mean that we have somewhere between 450,000 to 900,000 people
That's a
with
big
epilepsy.
portion. Wow.
Yes, that's just under 1 million people in Uganda.
Okay.
But again, the risk tends to be much higher in younger children and then in the elderly, dependent on the causes.
Okay.
Because there are some causes which are much more common in young children, and then also in the elderly.
Okay.
So what are some of these causes?
Yeah.
Now, epilepsy may be inherited. It can run in families.
Family. Okay.
So you may know that in some families you have quite a number of people. Maybe you have a child here, and then there is a cousin, then there is an auntie, or maybe one of the grandparents. Because there
Does it mean that's genetic or?
Yes, it may mean that it's genetic.
Okay.
But sometimes it may be a new change. It may be genetic, but what we call a new mutation.
Okay.
So in the egg or the sperm which gave birth to this particular child, there might have been a change in the genetic makeup, especially that which controls the flow of these electrical currents in the brain.
Okay.
And so suddenly you have a child with no other problem, born well, but you have something like this occurring, and there may be a change in the gene. But other than that, and especially in our communities, especially here in Uganda, many of the causes of epilepsy in our community have something to do with our settings.
Okay.
So in some children, the mother may have had a difficult pregnancy, might have fallen ill during pregnancy. Some of the germs cross over through the womb to the baby and affect the brain of the baby.
Okay.
There are others where it is due to a difficult birth. So a mother has a prolonged labor, problems associated with this prolonged labor. You have periods when not enough oxygen is reaching to the brain. The baby suffers brain injury, brain damage. They end up with epilepsy.
Okay.
Then after birth, we have a lot of infections. You may get cerebral malaria.
Okay.
You may have, especially in the newborn period or the first 1 or 2 years, babies can get meningitis.
Meningitis, that affects the brain.
The brain,
infection of the brain.
Infections of the brain. This cause problems. As the children grow, but again, and for almost all of us here, boda are everywhere. You're seated on a boda, you have an accident, you fall down on a tarmac, knock your head on it, and the next thing, you have a brain injury, and with the scarring of the brain, you get epilepsy.
Wow.
People are growing up with lots of stress. We have very many people with high blood pressure. They get stroke. You end up with epilepsy because stroke, you damage the brain. Then there are others, if they may have cancers in the brain, but especially with the elderly. That's why I was saying that in the two groups, either injuries in the newborn or in the later years. Our adult people, the elderly, as they grow older, you have so many small things. They fall. They are at higher risk of high blood pressure, diabetes.
That's right.
So it may damage vessels, you damage the brain, or even the cancers.
Wow.
So all these kind of things together. But also in some of our communities, we have other infections.
Okay.
We love pork.
Oh, yes.
We
are among the leading consumers of pork worldwide as a nation. Yes.
On Saturday when we are watching football, pork is roasting, and sometimes people hurry. It is not well cooked. So there is a pork tapeworm.
Okay.
And if the pork is infected by that tapeworm, and it's not roasted well, it has eggs. Those eggs will penetrate your intestines, go and lodge in your brain, and other parts of the body, you may end up with epilepsy. Telling you there are a number of causes of epilepsy, and some of the regions where I said that we have a lot of epilepsy.
Is high.
For example, in some of the places, there's even another parasitic worm. It has been associated with epilepsy, onchocerciasis.
Okay.
So there are a lot of the causes of epilepsy we have actually in our region are preventable.
Wow.
Either through improved antenatal care, checkup for me and you, that you're able to check your blood pressure every year, that you're not, your risk of getting a stroke is reduced, and many other things. The road traffic accidents, that if we are wearing helmets and then for those some of us who drive, that there is discipline on the road. Now these days you see everybody just overtaking, people bleeping, and then the next one driving on the other lane and causing so many injuries.
So in other words, most of the causes of epilepsy actually are preventable.
A number of them are preventable. But there are some where we actually don't know the cause to date. It just appears and you find it there, and you have no answer where this one came from.
Okay. Yeah, from your presentation, it helps to demystify some of the myths, because I hear there are many myths. I don't know what you've heard. I know you've attended to many, but I've heard about witchcraft, this child, and even it causes enmity between families. I don't know the other myths you've heard as you attend to these children.
And that is the sad part of it, and it's one of the reasons why really this is something that such a day will be commemorated, and we talk about it.
Yes, sir.
We said that epilepsy is due to an abnormal discharge, the flow of electrical activity in the brain.
Yes.
It has nothing to do with witchcraft. You find families breaking down. It has never been in our place, and this is what you have done. You have brought this. Or in communities, somebody is having a fit, and we cannot. It happens here. People just jump through the windows because that if the saliva drops on me, I'm going to catch epilepsy. I'm going to contract epilepsy. You can't contract epilepsy. There's so much stigma. You have homes where they have a child with epilepsy. People lock up the children. They tie them up. They don't go to school. And some of them, they're in school, even the teachers are afraid. They just call the parents, and the headmaster will tell you, bring back the child after the child is cured, because he's carrying every other person. Yes, because they think that the other children will contract it. So the child is kicked out of school, is condemned to a lifetime of poverty. These are some of the challenges. Stigma. But a lot of it arises out of inadequate knowledge.
Exactly.
It's inadequate understanding of epilepsy.
Wow. Ooh. Hope you're enjoying this and being enriched with information. And of course, our philosophy here at the DOCtalk show, when you get this information, don't keep it with yourself. Share with your friends and family, empower your friends on your social media handles, so that actually we help to empower people with knowledge. And as we come to a close of this segment, very importantly, which we must actually stand up against, is the issue of stigmatizing of these, especially children that are suffering from epilepsy. And we've heard from the specialist in studio with us, there is nothing to do with witchcraft, and you cannot contract epilepsy by associating with anybody who is affected with this. And it cannot pass on to the children or pupils or students in school for the teachers. It's very important information. These children with epilepsy are entitled to as much education as any other person. We will take a break and we'll pick it up from there in a short while. Thank you for keeping it with us.
You are watching the DOCtalk show.
Total Energies has undertaken a number of initiatives aimed at ensuring that Ugandan entities and citizens are adequately equipped to participate in the oil and gas sector.
We are contracted by Total Energies and its subcontractors to supply them skilled manpower, which they deploy at the respective projects. They are also going to work through us to begin to train many Ugandans around skills that are required to supply the oil industry. Because we're already working with Total in Uganda, we had so many suitors from Europe, Dubai, and the USA of potential manpower companies wanted to actually enter partnership with True North.
Total Energies EPILEPSY is committed to the empowerment of Ugandans to take an active part in the overall development of the oil project in Uganda.
You are watching the DOCtalk show.
We are back, still talking about epilepsy. For those that are joining us just now, discussing epilepsy. Probably you had the word fits or seizures or convulsions. Probably you had any of those terminologies. So that's what we are discussing this evening. And as always, your host, Dr. Joseph Gavin Nyanzi, and in studio with me tonight is Dr. Richard Idro, a pediatric neurologist working with Makerere University, and is shedding light. And just before we broke off, we were debunking all the myths about witchcraft, about teachers neglecting children with epilepsy in school, thinking that they will pass on this condition to their colleagues or friends, and very, very important. And we agreed that these children who may have epilepsy are entitled to all the other necessities of life as any other child. So they need as much attention as everybody else. Yes, Dr. Idro. So when somebody recognizes these symptoms in their children, or probably their elderly, maybe auntie or uncle or mother, what's the way forward? How do we advise them?
So the whole country, we have services for people with epilepsy.
Wow. Okay, that is very encouraging.
In Health Center 3s, in Health Center 4s, or general hospitals or referral hospitals, we have services of different grades.
Wow.
In the lower health units, the psychiatric nurses. Then as you advance Health Center 4, the general hospitals, you'll get the psychiatric clinical officers.
Okay.
And then, of course, with the doctors, the medical officers. And as you come to the regional referral hospitals, you will have the specialists. So the pediatricians, the physicians, and the psychiatrists, we are all there. And these services are available.
Okay.
Now, and with it, there are drugs also available. However, the range of drugs are different in the different levels. And so to you, you know of anybody whom you suspect has epilepsy, please, this person can seek care. In our clinics, what we do is to take history.
Okay.
We spend quite a bit of time trying to understand
what the problem
the description of the events, and especially from a person who has seen it. Because the person who is maybe getting the attack, if it's not the focal one, will not know what they are just told that you fell down, you collapsed. People are using that language. Try to describe, if you come with somebody, try to describe what you saw. He started jerking on the left hand, the eyes looked up, the neck turned to the left. It tells me, and it helps me in understand whether it is arising from a part of the brain or it is arising from all over the brain. Such information is important in the decision of what treatment to give.
Yes, and Dr. Idro, sorry to interfere. Is there sometimes where the person may become incontinent?
Absolutely.
Yes.
So especially the bigger ones where people collapse, you may froth. Some of them first become stiff, and you may hear sound because all the chest, the muscles are all stiff, tight,
struggling to
they
breathe.
cannot breathe. And that particular type does not last long because, I mean, you cannot last long without breathing. And then after that, you may start seeing the jerking. So you may see the person drooling saliva, they may bite their tongue, they may pass susu on themselves, they may pass poo-poo. It's because the body, the valve, the sphincters, the valves, which controls things, let go, as part of this this disturbance. Describe it in detail, because the diagnosis of epilepsy is based exactly on those things. We do not have a blood test to say that you have epilepsy. We use those descriptions, that history, that you have had at least 2 of these events, more than 24 hours apart, it looked like this. Of course, these events are very scary, but if it occurs recurrently and you have a phone and you are able to record a bit of it, it will be very useful for the clinician. So when you come in, we take this history and then we form our decision. We may order some tests, and those tests are to help us to clarify some missing information, but also to classify what type of epilepsy it is. Because we have a number of drugs, and these drugs are given, some of them can work all across board, but others we give for specific types. And that is the purpose of those tests. We may hook some wires on the head, connect it to a computer, and it does some writing, which we call EEG. Or we may send you to for a brain scan, a CT scan, MRI scan. It takes pictures of the brain, and especially babies. I forgot one cause. One of the causes is sometimes the brain does not develop normally. So you have a baby with an abnormal brain development. So you can see such on the brain CT or brain MRI. So with this, the majority of epilepsy, new onset epilepsy, is treatable. Indeed, 70 out of 100 or 7 out of 10 people who develop epilepsy, we give medicines and they will get cured.
Wow, that is the best news I've had this evening. I'll just repeat it. Dr. Idro has said 7 out of 10 of people that have been diagnosed with epilepsy, probably early enough and receive treatment, get cured. That is hope.
And they will get cured, and over time, we shall take them off these medications, and they live their lives, they go back. Now, of the remaining 3 out of 10, still 2 out of 10, we're able to control the seizures so that they live a meaningful life. They may get an attack, but occasionally, but we'll control it. The other 1 out of 10 requires other modalities, and we'll see these ones as you come to hospital. The unfortunate thing is, because of this stigma, because of the problems people have in the community in understanding epilepsy, whether it's witchcraft, keeping the people off, that it is something we have in the home, it is the grandmother's spirits, those ones. People don't come for treatment. So much that currently in the country, up to 60% of the people who require treatment actually are not coming for treatment. They are looking 60%.
Oh my God.
So they are looking for things which are not there when we have resources available to help them. That is the other second message I wanted to pass today.
Wow, that is very disturbing. 60% of our brothers, sisters, children, relatives, aunties, uncles, friends who actually should come for care do not seek treatment. They're instead going to
they're being kept at
herbalists, kept at home and told about this and the other, which is a very sad thing. I hope we go out in the community to empower people about this information. Yes, Dr. Idro.
Yes. Now, other than the regular treatment, the treatment for epilepsy is not like for malaria. it is taken for a long time.
Okay.
And you take it whether the attacks are coming on. When we start it,
Yes.
we tell you to take it whether the attacks are coming on or not.
Or not. Okay.
Even if you are going for lumbe,
Yes.
you go with it.
With your drugs.
If you're taking a journey, you go
Travel
with
with your
it.
drugs. Yes.
If you've forgotten to take the morning dose, when you remember it, you take it.
You take it.
Whether you are getting the attacks or not.
Very important. Yeah.
Until these abnormal discharges, we have suppressed them for a long time with this medicine. And usually we count until you have not had an attack for at least 2 years.
Wow.
So if along the way, 1 year you have not had an attack, then we start counting the 2 years again. So
Wow.
the idea is to give this medicine long enough until it suppresses these abnormal discharges.
Discharge of electricity in
Yes.
the brain. Yeah.
And then for children, because they are growing, we adjust the dose. So even if the child is not getting an attack, when they come in, we increase the dose so that you are giving it appropriate for the weight or for the age of
That's right.
of the child.
Wow.
Yes. Some of the medicines you may have to abstain from other things. For example, alcohol. You may need to get off from
Alcohol as you take this medicine.
Yes.
Wow.
And quickly, occasionally, despite this medicine, you may the person may still get an attack. And it's important when this person gets an attack that we know the first aid. And maybe that would be the next thing
Wow.
to describe.
Amazing information. Epilepsy is curable. 7 out of 10 of people that are treated actually eventually cure from it. That is a message of hope and very empowering information to pass on to your family and friends. We'll come back and Dr. Idro is going to be telling us about the first aid to give in case somebody gets an attack with a convulsion. Thank you so much to our sponsors, National Medical Stores and Camelin Men's Collection. We'll be back in a minute.
You are watching the DOCtalk Show.
International Women's Day is commemorated on the 8th of March every year. This is a day on which the role and importance of women is focused on, and also when mistreatment of women or violations of women's rights are addressed.
You are watching the DOCtalk Show.
Thank you for keeping it here with us this evening. We don't take it lightly that actually you turn on your televisions or your Facebook and YouTube channels just to listen to us. Thank you so much. And for sharing the link, thank you. And we are here for our last segment. Dr. Idro, we've talked about all these things about epilepsy, and you are just about to tell us about first aid in case somebody began convulsing. What first aid? Either child or an adult?
So in general, most of these attacks, when they come on, they usually last 1 to 3 minutes. And somehow the brain has mechanisms through which it can shut it down.
Okay.
So it tends to stop. The majority of them, 1 to 3 minutes, and they stop. And most of these attacks, if it does not last longer than 5 minutes, usually it does not cause additional brain damage.
Okay.
Now, we get concerned if, like, a person has epilepsy, we know is on treatment, but then gets an attack, a breakthrough attack, and then it starts lasting longer than 5 minutes.
5 minutes, yeah.
That one may require emergency medicine.
Okay.
But even then, even for the short ones, as we live around the communities, we need to know what to do.
Yeah.
And I'm going to start with the don'ts.
Things you shouldn't do.
Yes. Now, one of the common things which people do and is the fear that this person is going to bite the tongue.
Yes.
And because of that, they get a spoon, they push the spoons in between the teeth, and you can see these convulsions are really hard. And especially in children, their teeth are very sharp. In the elderly, the gum is a bit loose. And here you are busy pushing a spoon. You may break the tooth, and the person can aspirate it. It enters the lungs. Now you have a bigger problem. Or you may push the tongue, because this person is not aware of what is happening. It can close the airway. No air can go in. You may lose that person in the next few minutes.
Yes.
Please
so don't put
a spoon, don't put a stick, or don't put your finger there. Children might bite away your finger.
That's right.
Their teeth are very sharp. Don't. Even if the tongue is bitten, when you come to us, we shall suture it. It has a lot of blood supply. It will heal.
It will heal.
Do not attempt to put something there.
Yeah.
It will cause a lot of problems. Instead, move away things which can hurt this person, so that the person can lie down, and preferably if the person can lie on the side. And please do not restrain this person with a lot of energy.
To stop
you can break, they can fracture their bones. These muscles, they cannot control it. Some of them are very strong, you can fracture.
So do not try to stop the convulsions forcefully.
Forcefully.
Okay.
And the majority of them will calm down. But if you see it is starting to go beyond 3 minutes, going to 5 minutes, please call for help and see how this person can be moved quickly to a nearby health facility. There are some people who have prolonged attacks.
Okay.
Usually their attacks are 5 minutes, 10 minutes, 15 minutes. Those ones, when they go home, we actually prescribe for them some emergency medicine, and we teach a carer how to give that emergency medicine, so that it stops the attack. Because you can have accidents, like the tongue can fall backwards, somebody can choke. Or you may convulse for a very long time, and they can aspirate. They may vomit and then aspirate. It enters the lung, blocks the system. You can have problems, especially for teachers. We really like to encourage teachers that you know this information. Parents, do not fear the teachers of your children. Tell them that my child has epilepsy, is taking such a medication, and tell them what they need to do. But for all teachers who are listening now, this one will empower you, because if you have, like the UPE classes, you have 100 children in the class, probably one of them has epilepsy.
That's right.
So you are going to see these attacks in your class, your classroom. Yes. Even if you have 50 children, in the next class, that's a total of 100. Somehow one of them will have epilepsy. So you need to know what to do. 2, in the classroom, talk to the other children. Talk about epilepsy. What is epilepsy? Empower them. When the children go in the playground and their friend falls down, they are able to call you. That's a friend, and they're able to
the situation can be arrested.
Yes, address the situation, move away sharp objects so that the child does not get injured. Yes. Parents and teachers encourage the children to take their medicine. As much as possible, we prescribe medicines which are either once a day or twice a day. Some of the medicines are 3 times a day. But we try as much as possible not to give those ones unless it is really necessary. So that the child can take the medicine in the morning and in the evening. But if they have to take a 3 times medicine, then in the school, the teachers will be aware that they are able to give. These are really some of the things which can be done. Now, for the safety of the children, children with epilepsy, they're just, I said, anybody with a brain. Me with a brain, a child with a brain, and can get epilepsy. And so for all of us, you can do almost everything, except if you have to swim, let there be somebody
watching you while you're swimming.
So there is a guard. There's a guard. What do we call them? The
swimming.
I don't know whether the swimming instructors but somebody there who can get
watching
in.
Over you.
Yes, and you get an attack in there, somebody can pick you out. So somebody is watching. As much as possible, we advise against heights, so climbing high trees in case in case you go and get an attack up there, and then you can fall. For the older people, unless if you are still getting attacks, we advise you don't drive until you have been at least seizure-free for at least 1 year.
1 year, okay.
At least 1 year before you can drive. Otherwise, you're driving a vehicle, you're now moving at 80 kilometers per hour, and then
all of a sudden
you have an attack.
Yeah.
So, so in actually our driving permits, really, as people are assessed, this is one of them, in addition to eyesight, that this is one area which should be addressed.
Yeah.
Lastly, being a problem of the brain, children with epilepsy may have other problems.
Yeah.
So the brain, we said, controls every
part
of the body. So some of them may have learning problems. And especially if I go back to the teachers. See, if the child gets an attack at night, that thing is so exhausting.
Yeah.
So the child will sleep longer, will wake up longer after a longer period, and may reach school late.
Yeah.
Please do not punish these children. 2, some of the medicines tend to sedate. They make the child sleepy. Sometimes they may have taken the medicine in the morning, so when the child reaches school, is still a bit sleepy, is a bit drowsy from some of the medicines. Accommodate the
child in that state. Yeah.
And if the child has some learning problems, give additional support.
Yeah.
Some of the children, in addition, also have other challenges, behavior challenges. They may not sit still, so they move in the class, do so many other they are hyperactive. Please address that and give them that kind of support.
Wow.
Yes.
Wow.
That will really be helpful. And parents, make your teachers aware, and for the rest of us in the community, really to support these children. But I want to reiterate one thing, that many of the causes of epilepsy we have in our community are preventable.
Just like
attending antenatal care,
very important,
as said by the Ministry of Health, and where we can recognize these problems. After birth, we can prevent malaria. We should not suffer from cerebral malaria to damage the brain.
Yeah.
We know what to do. Sleep under mosquito net. The meningitis, we have the vaccinations.
That's right.
The childhood vaccinations, they're all over. The road traffic accidents, borders. Let's wear helmets.
Drive safely.
Drive safely.
Yeah.
When you are past 40, please annually check your blood pressure. Do a medical checkup every year.
Wow.
It's important.
Wow.
We'll be able to prevent many of the causes of epilepsy.
We would love to go on and on and on, because this is very important information, and I hope you've been enriched this evening, just like I've been. Dr. Idro, we are coming to a close of our session. Parting shots to the Ugandans watching you tonight.
This year, the 2 days coincide. Let us offer some love to children with epilepsy. I'm a pediatrician, but to all people with epilepsy. Let's support them. Let's encourage them. Let's not stigmatize them. Epilepsy, you cannot contract it from another person with epilepsy. Let's encourage all those who are in our homes who are not receiving treatment to come out and receive treatment. 70% or 7 out of 10 of them, the epilepsy will go into remission with treatment, and eventually we'll be able to win it off. Let's offer love on this special day to people with epilepsy, and may these children also live to enjoy their full potential.
Wow, thank you so much, Dr. Richard Idro, a pediatric neurologist working with Makerere University, as well as the immediate past president of the Uganda Medical Association. It's been a very wonderful evening, enriched with much information that is empowering us now. I hope we go out to empower others. Yours truly, Dr. Joseph Gavin Nyanzi, will be here next Thursday. Thank you for keeping it with us. See you next Thursday. God bless you.
The DOCtalk Show.